And now that we're on the topic of misconceptions, like what are some common misconceptions about clinical mental disorders, and how can dispelling these misconceptions contribute to better health outcomes?
Yeah, I mean, there's a tremendous amount of stigma around mental health. It's just now, I would say, in the last like 10, 15, 20 even years that we're really like talking about mental health in general as something that affects the general public. Because before there was a distinction between those who have mental disorders and those who do not. And there was no in between. Like either you are great with your mental health or you're quote crazy and you belong in an asylum or an institution. So it's taken us a long way to get to where we are. And it's still not like something that we're talking about. It's hard for me because it's like I'm in this field, I'm talking about it all the time, and then I get into the real world and I'm like, whoa, like, yeah, people really, it is highly stigmatized. I think, especially for, you talked about cultural differences and in some communities where getting help is stigmatized. Like, I think that's for an abundance of reasons. I think that religion can play a big role in it. I know it did for me. You're feeling this way because you're not praying enough, you're not faithful enough. Like that was a message that I remember receiving when I was younger. Also, don't share family business. Like that's another thing. There's a lot of mistrust with medical professionals and healthcare providers. And that's what I am classified as a psychologist in training or a therapist. So I think that there's a lot of stigma with seeking help outside of the home, knowing historically what healthcare institutions have done to our communities and our people. So I think that it's something that needs to be destigmatized, but first it has to be talked about. And I think that a lot of like mental health organizations or mental health professionals aren't versed on the historical harm that's been done through healthcare. So I think that that's something as well. And then I think that there's just the tendency, again, as we talk about like our society, of not wanting to ask for help and not needing help. And that being, again, that badge of honor that I can do it all by myself. I am strong, like I'm resilient. Like, these are things that we've been taught to really glorify and to really want for ourselves is to be independent. Whereas I think, the benefit in mental health outcomes comes from the fact that as humans, we're always seeking connection with others. That's a natural thing to want. It's a natural thing to want to share. It's a natural thing to see your health as connected to others. That's why we have relationships in general. That's why when you go out with your best friend and you're talking for hours, you feel good after. Like that's just a part of human nature. And I think the more that we can talk about that, the more that we can emphasize that, um, the more or the less stigmatized that mental health and seeking mental health care will be. And the benefits as far as mental health outcomes are tremendous. I mean, people are finally getting to talk about parts of themselves that they felt ashamed of, that they felt guilty about, and getting to do that with the intention of building a better you or improving yourself, improving your lifestyle, improving who you are, or just getting to be who you are in general, can help a lot because a lot of us live with a mask on. A lot of us live very inauthentically because of our environments. And when you spend your whole life hiding or ashamed, that can make you feel self-hatred, disgust, um, not worthy.
Yeah.
So I think there's a lot of benefits from seeking mental health, and there's also a lot of work that we have to do to get there.
Yeah, I completely agree. I definitely feel like I love how I visited your website, and I what stood out to me was how you have authentically Brian, and as I'm interviewing you, that's something that you commonly mention, and I feel like that is something that's so um, is such a good reminder to authentically be yourself. And I think the message that you know throughout this interview with the questions that I'm asking you, it always stems back from just not only your personal experiences, but just always grounding yourself when you're facing any challenges, or just going about your day to day, to always just authentically be yourself. I feel like that
Mhm.
good reminder for people to prioritize their mental well being is I feel like when people we're in a society where it's just okay for people to wear different masks and
Yeah.
want to just not openly communicate their true feelings towards situations. Communication is even a huge issue, not with
Mhm.
with social media and like people constantly being glued to their phone. Communication is often an issue to kind of spread that awareness. Like
Mhm.
with your peers, people just kind of isolate themselves, or
Mhm.
it's common for just out of comfort to isolate yourself. It's easy for somebody to like look up on their phone than to speak to the person that they're sitting next to. So even those little interactions, definitely, I feel like, that connection to people is what helps ground people to be there, to just be present and show themselves grace and gratitude when they're facing these challenges. So I loved all your responses, honestly. You've been such a great support as I'm trying to navigate through this interview.
Yeah, no
We're going
worries.
to wrap up shortly.